somehow missed this meeting.
Understandable. Got rescheduled at the last minute.
Make sure nothing's like giving us crazy feedback.
Thank you.
Alright, you should be good to go.
Chairman LaHood, you ready? I think we got it. If you vote for yourself, are you planning on voting for your bill? Okay. Are you waiting to see what you say to make that decision? If you, all right, wherever you want to be. John, podium.
So, thank you, Mr. Chairman. Thanks, committee members, for being here. I know everybody's scattered. It's trying to be in several places at once. This can be quick. It's very simple. So, back in 2020, there were some major, I'd say, transformation in policy over senior living communities and large personal care homes. And a lot of it was driven by, the raging COVID pandemic that was going on at the time. And so now we're with the pandemic in the rearview mirror behind us. We've had to clean up, almost every year something small. And this year it was became more evident that the testing of new residents and new hires, new staff members, testing them for COVID was a burdensome step that most providers aren't doing anyway, and the department is not enforcing because it's no longer a glaring issue like it used to be. So this bill just removes that requirement. Now, if there's an outbreak or something like that, we can put that policy back in place. The department can do that. But it's just not a routine need. And so that's all this does is just remove the requirement to test new residents and new staff members for COVID. And the department, I've spoken with them, they are fine with this because there's the overlying quality standards that must be met, the well-being of residents and all sorts of other screening for staff. And Chairman Sharon Cooper, who sponsored House Bill 987 back in 2020, she signed on to this with me also. So everybody's good. All the stakeholders are fine with this measure. So if there's any questions, I'll take any.
Okay, Chairman. So obviously, so these provisions were added. Just obviously these were not required prior to the pandemic. During the pandemic, we made a multitude of changes, and so now on the books, every new hire, every new resident has to go through this testing, and obviously, as you said, the department's not inspecting for this now, correct?
Correct.
All right. So I'm sorry, go ahead, Chairman.
And I was just going to point out that workforce is such a critical challenge in this industry, and so anything to speed up the hiring process is immensely helpful. And the same with a new resident moving in. There's all kind of hoops they have to jump through already, and this is just one more. And it's sometimes a tough time for these families and new residents, and we're trying to make it as smooth and seamless as possible.
Yeah, and a lot of the families, Chairman, I'm well aware, get frustrated with all of these hoops, and particularly something that they believe is long in the rearview mirror.
Correct.
So I understand how that can be a burden for the industry. All right, Representative Campbell.
Thank you, Mr. Chairman. I do have several questions about this bill. We have moved in a different direction. We are now in an endemic instead of a pandemic. But I'm curious to understand, testing has been proven to save lives, especially with our most vulnerable population in long-term care facilities. And we've known that since the start of COVID, and that continues to be the case today. That they are our most vulnerable population. So I'm very curious to understand more about when you describe this as being burdensome, what are the burdens, what are the costs, what's the impact? And then I'd also like to know if we believe this is an effective way to take care of our family members in long-term care. It's my understanding the requirements are a basic COVID test, right? That I took one this week. I wasn't feeling well. It takes about 15 minutes. So I guess I'm feeling very differently about some enormous burden when the effect of a 15-minute test that is pretty cost effective is proven to save lives. And I guess the last thing I would say is, would you agree that even though we do now have vaccines and we have treatment, that people are still dying. In fact, last week, 515 people died from COVID in our country. It's very difficult now to actually get the data because it's not published for this population. So I would also even suggest that because we don't really know when we're starting to have spikes anymore, because that data is not available, that the testing is even more important and more critical than it had been in the past to make sure that we're caring for those who are our patients.
Yes, so thank you for the question. Point well taken. And what I would say is that there's other policies in place for infection control, if more than, I think it's 3 people come down with the same type infection, there's all kind of notices that go out to the department, to the health department, to other residents, team members, staff members. This is not in any way doing away with precautions. This is just removing the need to test everybody, regardless of lack of symptoms or and things like that. This is just right now a blanket requirement. And like I said, the department's not enforcing it. They're not inspecting for it because, and their rationale for that is that there's already quality standards in place that the provider must meet, infection control policies otherwise, that make this unnecessary at this time.
If the chair would allow one just follow-on question. If testing is the front line of infection control. So if we're not requiring testing, it seems to me that infection control is extremely limited. Where we don't understand who is infectious.
Yeah.
This is the measure.
Right. Again, another thought that just came to my mind. Another requirement for every new move-in and every new hire is a physician's evaluation. And the physician signs off that there's no communicable diseases. And that's the same for a new hire and a new resident. So that's already there. That was there before the pandemic, and that's there now. And so this specific test that goes above and beyond all the other base layers of guidelines and protections that are already in place. This is just in addition to all those. And again, providers today, I don't know any that are doing this because it's just so unnecessary.
Okay, let's go to Chairman Bonner.
Hey, thank you, Mr. Chairman. Thank you. As I evaluate this, essentially, this is just a bit of a return to normalcy, correct? I mean,
absolutely.
We are simply returning to the normal standards and practices prior to the pandemic, and nothing precludes any level of testing and evaluation once someone is hired or once someone is in these facilities in terms of if they become symptomatic, correct?
Absolutely.
But
yes, there's a myriad of infection control protections in place that are triggered by any symptoms that present. Again, this is just returning to normalcy. It's a good way of describing.
Right.
what
No,
this does.
absolutely. I mean, I consider this, just deregulating an industry that's probably already heavily regulated. So appreciate
Absolutely.
the bill.
Yep. And on any typical day in these environments, senior living environments, there's just so much going on. This is just one extra step. 15 minutes is a big deal. It may not sound like it, but it's a big deal because you've got administrators, you've got your nurses, you've got your care staff, you've got maintenance. Everybody's got a part to play, and there's a lot of overlap in what a team, how they deliver quality care to the residents. And just any 15-minute distraction that's important.
Well, and just to follow up to that, I mean, again, I'm sorry, Mr. Chair, if I could, just to follow up to that, I mean, reading the current regulation in place, I mean, this says that a person in a long-term facility in this state shall be required to receive one of these tests. So what we are saying that if, as you said, if folks aren't doing it now, they're not following the law. And so what we want to do is remove not only a barrier to entry, but we also want to remove one more thing that could jam up a facility or a provider, correct?
Exactly, yes. Thank you.
All right, Representative McDonald.
Thank you, Mr. Chairman. I'm down here. My mic's not working. Of course, I went through, with my first year with this committee. It was probably the most important committee out there when we were dealing with this with hospitals, nursing homes. I mean, the rooms were packed with people. I mean, it was, Speaker Austin even went to the well and spoke on what we were doing in this committee, how important this committee is. I look at what we're trying to do today, and as we say, get back to a sense of normalcy. I kind of see a pretty empty room out there. I mean, if this was a big concern to the hospital industry, the nursing home industry, they'd be lined up. This room would not hold what 341 did back in that day. So, I look at our life has got to get back to a sense of normalcy. I feel like our institutions will do the right thing with their infectious control, and you got to have faith in them. You got to have faith in them employees. You did when you felt bad. You said that, hey, I took a test. And I think that's a sense of normalcy that I feel like we've got to get back to. Hey, I'm in the funeral business. For one full year, I never saw one person die of the flu, pneumonia. Everybody died of COVID. I mean, even if you were in a car wreck, you died of COVID. And, that's what every death certificate said. It's true. I mean, it was just, everything was COVID. I don't know what the racket was out there for putting that on there. So, I'm glad we're back to seeing on death certificates what people really, really, truly die from, whether it's pneumonia, flu, traumatic incident, and not just COVID. So,
Yeah,
thank you.
Well, thank you. And if I could just comment to that, this is in no way meant to be inflammatory or critical of those who wish to be extremely cautious. It's in no way a dig on that. This is just simply a return to normalcy, and removing a requirement that's not being observed today, and basically setting providers up for non-compliance when it's really an unnecessary rule. It was a late add to House Bill 987 because that bill started before anybody knew about COVID, and as 2020 went on, if you remember, the session was recessed and we came back in June, and this was a late add because of the circumstances at the time.
Right. All right, Representative Bell.
Thank you, Representative, for bringing this bill. I see the intent, but for me, it just seems a little rushed. Is the communicable disease that you mentioned, is COVID considered one of those communicable diseases?
Per my understanding, communicable means it's contagious, could pass from one person to another. So yes, and so thanks for bringing that up. The physician's evaluation, it's a 2-page report that the physician fills in, and that's one of the questions that's asked, and the physician has to verify that the person is not carrying a communicable disease that can spread to others.
How does the physician verify that they're not carrying the communicable disease?
Well, typically they're seen in person by the physician. If symptoms present, then that physician would do the proper diagnostic test. A TB test is required. That's one of the baseline requirements. So an evaluation is how that's determined.
Thank you. May I have a follow-up, Chairman?
Yes, sir.
Is the 15, you mentioned the 15-minute test that takes 15 minutes. Is it in how it's written out, does it require the 15-minute test, or does it require the more so antigen test, or the one that takes a few days? Is there a difference between the two in the requirement of how the bill is written out?
Yeah, when I said 15 minutes, I was just referring to Rep. Campbell's comment about it taking as little as 15 minutes. Mm-hmm. I'm not aware of a requirement here on what kind of test is used, but even if it takes as little as 15 minutes, that's valuable time. That's taking multiple people 15 minutes. The one being tested, the one administering the test, somebody to read results, document it, there's a chain reaction to every new rule that's put in place. And again, this does not prevent tests from being done. It just removes the blanket requirement from the general population that wants to come work in one of these settings or become a resident from, having to be tested, regardless of how healthy they are.
Chairman, just to make sure, so just to be clear, we're talking about here personal care homes that are more than 25 beds. So what we used to call congregate personal care homes, and then assisted living communities, which are always congregate settings over 25, and then skilled nursing facilities. Those are the ones we're talking about. More so with skilled nursing facilities, but in assisted living, having lived in that world many years ago, everybody, when they are admitted, any individual admitted has to have a physician's what do we call it?
Physician's evaluation report.
Yeah, it's an evaluation. I forget that we had a name for it, but that valuation goes into, and obviously it's got all their medications, and I mean it goes into pretty much detail.
Yeah.
They should be seen prior to admission. Families are required to get that. They take it with them to the doctor. He fills it out. They bring it back, and that is a requirement of admission. Just to make sure for those that aren't in the, it's a much more stringent process. Of course, with skilled nursing facilities, where oftentimes people are coming straight from hospitals. Having said all of that, isn't it true that any facility can continue to put any kind of requirement they want on there?
They could,
if they feel like there's a need or there's maybe something in the community that causes them to do so, and no one that I know is more concerned about the health of seniors and individuals in these facilities than the people that operate them, because they make their living serving them, and their whole life and commitment is to serving people with all of these different skilled needs in these facilities. So isn't that true? And aren't those requirements still there as they were back when I did this?
They are.
Okay.
Yes,
gotcha.
they are.
Thank you.
And another thought that just came into my mind is, there's all kind of communicable diseases that we can test for, but they're not required to the general, population of people entering these settings, like strep throat or flu or all sorts of tests that we could require if we decided to, but they're just not. You don't test for them unless there's a reason to, and that's what we're addressing here.
Getting back to where it has been over many years. All right, Representative Campbell, number 15.
Thank you, Chairman, and thank you for one final round of questions. I just feel very uncomfortable with the idea of removing this cost-effective, proven methodology for preventing the spread of a disease that, for this population, is extremely dangerous and such a high propensity for severe illness and death. And I think two other points I wanted to share. When we talk about 15 minutes and the return on investment, I hear you and understand, and yes, every minute in a healthcare facility is precious. But if that means that even one patient is prevented from getting COVID, and the money that the suffering that we could save, but also the money we save from treating this kind of illness, potentially far outweighs to me the cost of the time spent to prevent it. And I guess the last thing I would also say is that, in addition to not really now having a lot of data to understand in advance when we have spikes, testing could be an aid in that area. But also we know, per the latest CDC data, that the staff at long-term care facilities is not vaccinated. Right now the percentage is about 4%. So again, it's just one very easy measure to help protect our patient population. So I'm just going to encourage the committee to think long and hard about this. I mean, to me, normal should be, are we using the science and the resources and the very cost-effective tools that we have, every tool that we have, actually, to keep our patient population as safe as possible.
Yep, I appreciate your point. Well taken. I respectfully disagree with you. We have in these communities, these senior living settings, we have visitors coming in and out all day long. Like you mentioned, the staff, they go home every day to their families. Some of them have other jobs. They're coming in and out. There's 3 shifts a day. There's so many exposures. Testing somebody that's not symptomatic, that the physician has already signed off that there's no communicable disease, it's just another unnecessary layer of bureaucracy, really. And so I didn't intend for this to be an inflammatory thing. That's not what it is. It's just simplifying the process of operations.
It isn't, Chairman, it's not inflammatory at all. We're having a good debate, good questions all. I do want to ask, is there anyone here from are the nursing homes here at all? I'm surprised they're not here.
I did speak with the
Mrs.
nursing
Chairman,
homes, I did speak with the Nursing Home Association yesterday, and they're in full support of
Yeah,
this.
I knew they were supportive from what they had led me to believe, but I thought they might be here to speak more to this. I was going to say something, but let's go to Representative McDonald.
Thank you, Mr. Chairman. I know, we've talked about the 15 minutes. I wanted to ask kind of a question. Is that 15 minutes that it takes to take the test and get the results? Is that, I was a little unclear. Yes, I'm just kind of trying to figure out that we talked about 15 minutes a lot. I just hadn't done it in forever, so I'm asking kind of some clarification on how long these tests take and how long it takes to get the results. Somebody.
I think what Representative Campbell, correct me if I'm wrong, I think she was just referring to how little time it could take to test someone for COVID. And it could take as few as 15 minutes, I think is what she meant.
To take the test?
Yes.
To take it and get the results. Okay.
Yeah.
All right.
So in a 24-hour day, that's not very much time, but in the scheme of everything going on and the other things the important things we want to pay attention to, fall prevention, making sure medications are delivered correctly, making sure the therapeutic diets are prepared. All these things, this is just a distraction in taking time and attention away from the things that really matter.
Chairman, as it relates to, let's think of something like the flu. So flu vaccines are not a requirement for residents or staff in these facilities, but testing and things of that nature, there's no other testing of individuals that is required in facilities. And Seth, I'm looking at you as well, representing the industry. There's nothing else like this that is a requirement.
Tuberculosis is the only one that comes to
TB.
mind.
TB has long been
right.
Historically a requirement.
Yep.
Okay, gotcha, other than TB. All right, we're going to go to Representative Bell.
My question, thank you, Chairman, for recognizing me. My question goes to kind of your point again. Other diseases that we are testing for other than COVID? And then second, other than this bill only deals with the first time a person's moving in and the first time a person's hired, right?
Correct.
And are there any other diseases other than tuberculosis that we're requiring testing for first time move-ins and new hires?
No, only tuberculosis.
Okay.
Yep.
Thank you for your response.
All right, Representative Campbell.
That was left over from.
Oh, that's, okay.
Hanging Chad.
All right, Seth, would you like to, Chairman, would you like Seth to make a comment or?
Certainly.
I see he's here.
I think that'd be good to hear from Seth, being the government affairs representative for the Georgia Senior Living Association.
Yeah,
he can
Seth,
speak for all of our,
right.
I think almost 500 members.
Okay, thank you.
Yeah, thank you, Mr. Chairman, for hearing this bill this morning. Thank you, Chairman LaHood, for bringing it. Appreciate the questions today. I am Seth Daniels. I'm the Director of Government Affairs for the Georgia Senior Living Association. We represent assisted living, personal care homes, and memory care. One of the things that Chairman LaHood referenced, but I just want to reiterate in this, is that we wanted to bring this bill this year because it's not really being done. It used to be something that was checked for regularly in surveys and inspections. As time went on, it wasn't really being checked for anymore because it was just less of an urgent issue. And so when our providers asked us if they still had to do this, the handful that were, we asked the department, and they said, well, we can't tell you not to. It's the law. So that's the purpose of bringing the bill today, is to have some uniformity in enforcement, because you don't want somebody to get dinged for not doing it, and technically they kind of have to. But the vast majority, 99%, are not doing it and are not being checked for it. So this just kind of addresses that potential disparity in enforcement. I feel like I had one other thing to say, but
Seth, what can I ask you a question? So on surveys by HFRD, so Healthcare Facility Regulation Division of DCH does inspections in all these facilities. They are not looking in any way, shape, or form today to see that Ms. Smith was admitted on February 1st of 2025, and she came in with you've documented a COVID test. They're not looking for that. They're not looking in staff files to see that when you hired Sally Jones, she had a COVID test, because they simply are, because the pandemic has moved on. And so this was really a measure that was implemented at the height of the pandemic. Right. Is that correct?
I'm going to butt in, if that's all right.
Yes,
Mr. Daniels brought up a good point, and you asked a good question. And it reminded me that the department will tell you that hiring and retaining surveyors is a challenge for them. And so, again, they would say that their staffing, their workforce is strained. And so this is just one more thing that they would have to, per the letter of the law, have to check for on a survey. And it's something they're not doing. Because there's so many other things, more important things, related to the well-being and safety of residents that need to be prioritized.
All right. While y'all are both there, we have Representative Sampson has a question.
Thank you, Mr. Chairman. So, Mr. Chairman, my question is this, and maybe nobody necessarily knows this, but when we talk about the aspect of testing as it relates to turnover with staff and turnover when it comes to beds, we're talking about 25 beds. What does the turnover rate look like when it comes to these beds, and what does the staffing turnover rate look like? Because when we're talking about 15 minutes, we may be talking about that, every 4 months or every 5 months, where we get one person tested. And so my thought is, if the turnover rate is pretty stable or pretty low, then the 15 minutes becomes kind of an innocuous thing in the sense that it should not be a bother to anybody.
Appreciate the question, and there's no one size fits all. Aware of some senior living communities who might move in a dozen people in a month or more, and there's some, like you said, where there's very little turnover for several months. But the hiring process is a long, there's a lot of steps that go into hiring someone, starting from the interview to all the screening, background checks, physician's evaluation, all these things. And so I would say in the average, licensed community that we're referring to here, there's a number of new hires every month and a number of new move-ins every month.
Okay, Representative Bell.
Thank you again for bringing the bill. I hear the concerns from the industry. I hear the concerns of the committee. But I hate to sound like a conspiracy or a deep fake, deep state type person. But with the repeal and the rollbacks that are happening at the federal level with the CDC and other infectious communicable diseases, I would hate to, in the future, we look back and we see that we rolled this back as soon as the federal government's doing something crazy because it's a money grab, because the turnover rate. I mean, I hate to sound like a conspiracy, but it's only a conspiracy until the CIA releases the tape or the FBI declassifies it. But I get it. I understand it. I understand that we need to get people in bed, that people need to get to work, that we need to have a viable workforce. But the conspiracy in me just seems like this may be a little rushed. But I understand completely. But I don't want it to come back and bite us in the foot.
Right.
As soon as back with vaccines and, all right,
Yeah, my concern here was that this would become a bigger deal than it really is, and that seems to be what's happening here. This is no hidden agenda here. It's just a very simple cleanup, and I think it's so simple it's becoming complicated.
Well,
But another point that Chairman Petrie made earlier is providers that own and operate these communities or work in these communities, they want their beds full. They want to serve as many people as possible. Most of the time, when a prospective family or resident comes and inquires, they're in some type of crisis or impending crisis if they don't get moved in fairly quick. Like they're a fall risk at home, or they're non-compliant with medications at home, or there's memory issues and they're at risk for eloping. So any barrier to getting them in a safe environment as quick as possible is putting them at more risk than I would say the risk of them spreading COVID to someone when they're asymptomatic. If they're symptomatic, absolutely, the physician wouldn't authorize them to move in anyway.
Thank you, Chairman. So I think everybody here is fully discussed it. And I appreciate this is a great conversation. We need this on every measure. But at the end of the day, I think what you're trying to do. So individuals that oftentimes are coming from more skilled facilities, oftentimes are coming from nursing homes to assisted living and vice versa. Oftentimes are coming from hospitals to all of these different long-term care facilities. They're all being treated by a physician. They must be when they're admitted. We have a multitude of things that people can have, sadly, that we deal with, but none are being carved out and treated separately, except this one when we had a pandemic. That pandemic has now moved on, and praise God, and largely. And so we have the opportunity here to address this or not. That's up to the will of the body. I'm going to go to Representative Chairman Bonner.
Thank you, Mr. Chairman. Appreciate the good debate, good conversation. I recommend a do pass for House Bill 645.
Okay. We have a motion do pass. Any second? Okay, we have a second. Is there any further discussion? Did you have we had a light down there? Was that, okay? Any further discussion on this measure? Representative Bell.
Sorry if I'm novice at this. I know it's a shall right now. Possibly could we amend it to a should? Just to recommend that, so that employers can have their own preference to test or not to test, but it's just a recommendation more so that they should test.
Yeah, Representative, I think we will not take that up because they are, by definition, they all can if they choose to. That is all, and by the way, those that have any concern, as we pointed out, because of something that's happened in the community or an individual in the facility or somebody they learned about from a child or a grandchild of a staff member, they can always do that, and I know likely are doing so. So the industry does their best to make sure that, I'll tell you one thing I do know for sure, if you don't keep people well, you don't keep, you spoke to beds being filled. And I hate to use that term because it's really about providing care to people, but to use that term as in industry, if you don't have people to serve who are living in that facility, you can't survive and pay staff and make a living. And so nobody wants to keep people well any more than these industries. I believe that to be true. Okay, no further comment. We have a motion and a second. All in favor of, let's make sure we got it right here. Mr. Chairman, let's make sure we got it right. It is LC 461108. LC 461108, we have a motion, we have a second. All in favor, say aye. 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 All opposed?
No.
Okay. We have, can the noes raise hands so we know? All right. 3 noes. All right. The yeas. 1, 2, 3, 4, 5, and 6 if we count the hood. Okay, this motion, this bill is passed. Thank you. Thank you all for being here, and thank you for all the very good questions. They were all very helpful.